You're welcome back. This is Newsfile, it's your most authoritative news analysis platform. And this is where we will always put Ghana first. My guests have been Kweku Baako, Editor-in-Chief of the New Crusading Guide newspaper, our regular panelist, Joyce Bar-Muktari, special aide to President John Mahama, and Esla Owusu-Ekofo is MP Ablekuma West Constituency and Minister of Communications. Now joining us also via Zoom is Dr. John Amoesi, and of the KCCR. Thank you very much once again, as always, for joining us, sir.
No, thank you very much, Samson, and to all those in the panel and also on Zoom. I've really been enjoying the very stimulating discussions.
Right, and on the panel,
well.
On the panel is one of your biggest fans, Kweku Baako. All right.
No, I've been totally flattered by some of his comments.
Yes.
Good morning to you, Kweku.
Right.
Thank you. Good morning.
Okay. So, Doc, from what we see now and looking at the way the disease is sort of misconducting itself around the place, do you think that there's a need for a rethink in opening up the schools and the present mass gatherings that are happening, albeit under the protocols that are being observed? And I think that the EC deserves the credit that after the first round and after the criticism, you can see that a lot has improved.
No, thanks for that question, Samson. I just want to reiterate a couple of points that I've made a number of times on your show, which is just the facts regarding how this virus spreads. And that is, the more people gather in the space, the increase in the risk of transmission of the disease. This fact must be emphasized repeatedly. Because it is devoid of any abstraction or ambiguity. It is just very clear. Now, when that happens, or when this understanding is clear, it means that any activity which will result in increased human interaction will increase the risk. The question is always, what quantum of risk will we increase this by? So when we speak of whether we need to reconsider or otherwise the reopening of schools, it may neither be here nor there. What I would say is that right from the get-go, we should have, and I say should have because I don't know if we do or we do not, but should have in place some ballpark figures or some cutoff points beyond which we say, okay, if we go beyond this point, then we will do A, or beyond this at another point, we will do B, right? Because no one can certainly argue that there is no point at which we will say we cannot continue school any longer. It means that there is a point at which we would have to reconsider this. What I don't know is what that point is, because it has not been put out in the public domain. And this is where I have repeatedly called for these cutoff points or this algorithm to be made public, so that even independent people like myself can monitor these and provide very useful comments on the situation, the direction in which we're going right now. So to cut a long story short, I would say, yeah, there must be a place where we reconsider our activities, reconsider reopening of schools, reconsider restrictions on movement, and reconsider policies. There's always a place for this, but we just don't know where that is right now.
So there's a lot of clamor by parents who have had to run to the few schools that have reported, infections and having to deal with them. And people are looking at all of that and saying, let's just shut the schools.
Right, Samson. No, unfortunately, it doesn't work that way, right? I have to be very clear. The fact that there's an infection or 2 or 3 or 4 or even 10 or whatever does not automatically mean that you shut down everything you're doing. It's a function of, what is the population in that place? What is the proportion of people who are infected? When did you get to know of this infection, and therefore how many people could be infected? Now, with this virus, there's two things that make it very difficult for us to arrive at decisions, but nonetheless, we have to find a way of arriving at these decisions a bit quicker than we are currently doing. One is the fact that we have delays in conducting the test and also in receiving the results of the test. There are numerous people who have wanted to do, who cannot do the test any longer because now the policy is you don't get a test unless you are ill, unless you're sick, probably ill. There's also a number of people who have been in very close contact with people who are infected, either because they live in the same home with them or share an office space with them, who on the normal circumstance when we're doing the enhanced contact tracing would have been reached out to and have their sample taken. That is not happening any longer. So that's a delay in testing. Now, if you're fortunate to get a test for one reason or the other, how quickly do you get your result? Which means that there is a delay both at the back and at the front. So at the time you get to know someone is positive, the probability that they've been in contact with several other people is very, very high. But then there's the other side of the coin, which is the asymptomaticity. And the research is showing that we can have up to 70, in some places even much higher percentage of people who are asymptomatic. We've seen from right here in Ghana, the findings from the Ministry of Education, if I'm right, the Cocoa Board, if I remember correctly, and a couple of other government institutions which have had high numbers of people testing positive. And if you should inquire further, you'll realize that the greater majority of these are totally asymptomatic. In fact, the testing was precipitated or motivated by one or two people who felt that they may have been ill or have been in contact with somebody who was ill. And so they decided to test everybody in that space and realized that, oh, look, I'll tell you, many corporations, institutions will tell exactly the same story, except that these are not in the public domain. They do a test and voila, 60%, 80% positive. It tells you that we have a lot of people who are asymptomatic. And we've had to be dealing with this from phone calls from friends and family, all kinds of things. But when you have these two situations, the delay in testing, the delay in getting results, and then the issue of asymptomaticity, then you realize that when you have 1, 2, 3 cases in a school or in a close population, as we would say in public health terms, then you can be sure that there's a lot more people are likely to be infected, because by the time you got to know that A was infected, many more people will be infected. But then the other side of it is that many of them may actually be asymptomatic. The challenge with this disease is that we just cannot tell who will come down with severe disease.
What should we be doing, knowing the numbers we know now and how the spread? Because now we know that the spread is growing exponentially. So knowing that fact, what should the approach be? Thankfully, we are told that what we needed has come in, even though it delayed, because people had done tests, and for almost a month, they didn't have the results. And as you mentioned, from where I sit, I have had doctors, medical practitioners get in touch with me and express a lot of worry that they have tested and the results not coming in, and they have to go to work. And some of them actually believe that they heal even by the time that the results would have come. So what should be the approach going forward?
No, you hit the nail right on the head. There's many people who, by the time they get their results, they sometimes call me, call some of my colleagues here. And the answer we give them is, look, when we look at the timeline between when you were tested and when you got your result, by this time you're actually pretty fine. Nonetheless, for specifically the school situation, what I'd recommend is when you have an outbreak like what we're seeing, especially when you have someone who's symptomatic, someone who's ill, you want to move in quickly and conduct a quick test, not of everybody, but of a certain subset of that population, to have an idea, especially those who may have been in very close contact with the individual, either in the same dormitory or in the same classroom, to have an estimate of what the situation will be. Now, let's just reflect that on some of the decisions that have been taken at our ministries, like the Ministry of Education and other places. you realize that they have shut down completely, or let me not say shut down, but they've closed their offices. They've closed the offices. Why? Because they have the luxury of being able to test a certain proportion of people and realize that we've got a large number of positive people here. We've got to close the offices for a while to allow these people to recover and reduce the risk of spreading to others. Why don't we do the same thing in the schools where we have an outbreak? Because we don't have an outbreak in every school.
Right.
Certainly mass testing would be great, but we just can't do it right now in this country. Where there are outbreaks, moving there, do a test of the subset, and then based on that, make a decision. And we've got to be able to call that decision of closing a school if we really need to make that decision. Unfortunately, a minister can decide to close the offices of a ministry, or a director can close the offices of his or her institution, but a headmaster or headmistress, especially of a government school, cannot call that shot. And it makes it a bit difficult for them. And I really feel for headmasters and headmistresses who will be in that position where they cannot really make any definitive choices. And those who can make those choices really have to be able to gather that information, which will help them to make that decision really quickly. Unfortunately, currently there are too many delays in arriving.
So there's no science behind the suggestion that if the Ministry of Finance is closing its offices, the Cocoa Board is closing, the courts too, relatively, BOST is closed, Great Co offices, and the president himself is going into isolation. These are places where you say you have adults who can exercise a lot of responsibility. And then you are leaving rather children who may not be able to exercise same level of responsibility, and schools that cannot afford what these can afford to protect themselves, rather to stay open. You are saying that suggestion, there's no science behind it?
Not necessarily, and maybe I didn't quite get you right. Maybe if you can just come again with that question.
The concern is that if these places are shutting down because they are discovering infections, if the president, who gave an assurance and promised that he will not put any child in harm's way, is going into isolation having had someone connected to his office, test, positive or something, then it should rather be the case that the schools should not be working.
Oh, I get your question now. So what I was saying was that for the ministries, the BOST, the Great Co's, and the others, they have tested and have been able to ascertain that they have high levels, 60%, 70, 80, even 90% of people there infected. And at that point, no one needs to tell you that you can't keep going and coming to work.
All right.
Two things in school. One is the school is a closed population, which is we don't have the students going and coming. So it's a very close population. So the risk of spreading, outside or bringing something furthermore from outside is lower. Number two is we're actually not testing in these schools that are having these outbreaks.
The school, Doc, is not exactly a closed population, because some are having to go to school and return home.
No, you're quite right. No, when we say a closed population in epidemiologic terms, they hardly can be anything like a fully closed population. There will always be some porosity, but maybe I should have used the expression a well-defined population. That may be more appropriate. So I was just explaining that unlike in the ministry and other places, people come to work, take public transportation, go back home. You don't have that same level of interaction for schools. As much as you'd have in these public places. Nonetheless, we should put ourselves in a position where we can make that decision as to whether the school should remain open or not. Unfortunately, as I was saying, we are not collecting this information. We can't even determine how far it has spread. And what I'm really itching and needing is to see what the cutoffs. What are the cutoffs? At what point do we say no more? This school must shut down, or so and so and so. And I think Ghanaians really should need to call for this so that independently we can look at this and say, okay, we've gotten there. We've got to do what we said.
So in some 30 minutes, would you that we adopt what we know is happening elsewhere, where they are clearly situations? They say if there is one infection within a class, that class is suspended. If you have more than one infection within the school, the entire school is shut down. Should we have some protocols like that? Because we have a situation where as many as 6 students are infected, and we say we shouldn't shut down.
No, I think it's echoing what I've already said, which is that we need to know what our cutoffs are. Now, when you speak of cutoffs, like if you have one infection in the class, the school should shut down. If you have one infection at school, the school should shut down. These are all functions of many things. Functions of the level of interaction among the students, size of the classes, size of the schools, the amount of mobility that there is between the school and the outside world, and so on. It's very difficult to say that a single infection should warrant a total shutdown. We have had situations where in well-defined or even close populations, we've had a couple of infections. There has been no shutdown or no closure, and it has been able to be contained. In other places, this has not worked at all. And now they live with the regret that they should have taken action much earlier.
I see.
There's always a fine line between, using a very heavy hand to using a bazooka to kill a cockroach, and that cockroach would die all right. But then you've wasted a whole, a ton of ammunition on just a cockroach, and is it really worth it?
Okay.
It's difficult to tell, but what I would press for, and what I think the media should press for, is to know the cutoffs. When we get to know the cutoffs, then us, the professionals in this area, can then come and criticize the cutoffs and say, no, your cutoff is too low.
All right.
Most often than not, we will not say too high, but we'll say it's too low.
Thank you.
But
Thank you very much. Thank you very much. We clearly need to know those protocols, as we have come to know exist elsewhere. If one person is infected, a class is suspended. If more than one is infected, a whole school is suspended or shut down. Or if there are 5 infections, there are 10 infections, at what point do you shut down or do you suspend school activities? And that is important. Now, Kweku, Dr. John Amosi doesn't seem to subscribe to the situation where, like in Kenya, they have declared the school year lost, as is reported. So what do you make of what is going on? How should we go about this situation? Again, we are not unaware that this is what is supposed to be the new normal.
See, let me be honest with you. When it comes to these discussions relative to COVID-19 and the protocols and all those things, I'm absolutely inadequate and uncomfortable. As a human being, I feel worried. And know that things must be done properly. But I'm totally incompetent when it comes to dealing with these matters.
What do you say to the agitated parents?
Yes, I was coming there. Those who ask for closure of schools or perhaps cancellation of exams, for how long? That's the first question I ask myself.
Maybe like Kenya. The school year is lost.
Yeah, but for how long? When is COVID
for the year
exited?
2020.
And that is assuming COVID will be gone. COVID-19 will be gone. You see, it's an uncharted territory. Dealing with it itself, the methodologies, the philosophies, everything keep changing daily. It's not the best time to be in government, really, to be managing this process.
Right.
I'm telling you, it's not the best time.
The president said that we are easing the restrictions with a caveat that depending on the science and data, we may have a certain review. Yes. From what you have seen, there's no cause for a review?
There might be a cause for review relative to some specifics. I'm not for a total lockdown. We all know it's not an option. And we've just been to even mass testing too. It's not an option. We don't have the capability now. So yes, my understanding of what the president was saying was that we'll be looking at localities and some areas and perhaps apply some localized shutdowns or some protocols.
Right.
And as I said, the problem I'm having is that I do not have that technical understanding to be able to advance specific solutions to this problem.
Okay.
I just feel it. But to ask that schools close down, I said, how long? cancel examinations. For how long?
Right.
Because I can't see when COVID-19 is exiting this world.
Elsewhere in America, some universities elsewhere have declared that the whole year there's not going to be any
You keep on saying the whole year. The whole year, that's specific, time frame.
Yeah.
But post that whole year, would COVID be here or not? And if COVID is still here, another whole year, isn't it?
So
that's why I have a difficulty.
COVID showed up, we were told that at least we give ourselves some 18 months.
Is that what the WHO is saying?
That's initially the CDC and the rest of them.
I'll pray it is 18 months. That would be short. But from the way things are going, I'm not too sure.
Okay.
We don't even have a vaccine yet,
right.
do we?
Let's get to Esla. So you are in government. How do you feel about people who say we need to review and impose stricter impositions because of what we are seeing? What do you say?
Just 2 quick points before we get. I think the Bloody Widow 2 was a low point that the NDC ought to apologize for, including the MP who actually came to Parliament because of the death of her husband. And they all walked out and held placards calling Sarah Lydia Alassane a bloody widow. And I was like, even you two, I've lost a great deal of respect for the NDC female parliamentarians since that point, and I needed to make that. And I never heard any of them, including Joyce, condemn that. On the contrary, they defended it. But that's an aside. And also, I've just been informed that face shields alone are not enough protection against the virus. And so Samson and Kweku, be careful. Don't wear this outside the studio, but wear the face shields with the mask, because the face shields only protect against splashes. So I think that move to face shields, we should watch it.
Right. A number of
like
doctors, physicians have given us advice, like you just did, and some others have also suggested that if we're going to be speaking for 3 hours here, we should not be wearing a face mask and inhaling back our own stuff. And so we are in a bit of a dilemma, but they seem to suggest somehow that once all of us within the building have a certain covering, the protection is assured. So please proceed.
I don't want to comment on that.
Right. Yes, okay, Dr. Mwesi wants to say something briefly about that.
No, Samson, I was just looking for a leeway to come in on the face shield, because I wasn't very impressed to see you guys in face shields, and I even saw the Honorable Chairman Sabonsu also when he was talking to the journalists also in a face shield. I wasn't impressed at all. Right. I'll tell you why. The current position of the WHO and the knowledge that we have regarding how this virus spreads now is tethering on the brink of even being spread by aerosols or being airborne. Yeah. So I remember very well that we had an online meeting for church leaders on Sunday, and we were discussing what to do starting this tomorrow, Sunday, and I suggested that we have a very big stage, which is very long and very wide. So I suggested that, okay, Reverend Minister, you can stand at the far back of the stage. The front rows or pews are quite a significant distance, well over maybe even 20 meters from where you will be. So you can just use a face shield. But when the new information came out and I studied it carefully, I had to call him and say, look, I gave you some information about this face shield business. I actually have to backtrack right now. It's not going to work because, especially we're in an enclosed space in a building, the risk of the droplets
being in the air
to some degree and then becoming aerosolized becomes very high. Okay. So the face shield business will not cut it.
All right. Thank you very much. Thank you. Thank you, Doc. Thank you, Doc. We are running out of time, so I need my guests to quickly comment on the issue at stake. So if we can have Esla in under a minute, we need to take a break. So under a minute, what do you want? Do you want more restrictions?
We can't afford more restrictions now, but we all need to be more careful. So I couldn't agree more with your opening statement. And then once your sample is collected for testing, please assume that you're positive. and self-isolate. Then you take on the responsibility of protecting yourself and those with whom you're in close proximity. And in our schools, I believe that they would have isolation sick bays and stuff like that, where the children who are infected can be isolated. I think that with the controlled environment of our schools, our children even are better protected than in our homes. Let's face it, many of those infections were brought in from home and not from the school. Once in, we should have the protocols, and I think they already are in there. And they're working with the Ghana Health Service to ensure that the rest of the population is protected. And I believe that in the schools where infections have broken out, the significant samples have been tested, and they're clear in their minds that they don't pose a significant risk to the rest of the population. Let's not get too scared. But we don't know how long this, like Kweku said, this thing is going to last. So close down the schools for how long?
All right.
Defer exams for how long?
Thank you. Thank you very much. Thank you very much. Can we have you in 30 seconds before we take our break?
Well, very, very quickly.
I need to take a break right now.
You know that I'm sure the Honorable Jinapor has actually sent you a text message. And Esla, he says that all that you said are mere fabrications. He utterly disagrees with you and denies extensively what you just said about him. I think that maybe you should have consulted him first, actually, before making the statement. And then, of course, quickly to the Ayawaso West Worgon matter. It had absolutely nothing to do with Lydia, who is actually a relative of mine. It had everything to do with the violence. So if you talk about the description that were used on the inscriptions, then we can have that conversation. But note that even the president himself had reason to set up a whole commission of inquiry into this matter of the violence that characterized it.
Should restrictions be reimposed?
Well, that's a conversation we can have as we go along. You know, I have young children, and I have actually spoken to some of the kids who are currently in school and on campuses. Samson, they are not social distancing in the dormitories. We've all been in boarding houses. I think that a lot more education is required. Certainly this ailment is going nowhere. This virus is certainly going nowhere. I pray that very soon we do find a vaccine, but certainly first and foremost, and I remember President Mahama had said this at the beginning, we need additional PPE. We need to ensure the safety and protection first and foremost of those who are in the hospitals manning these activities. And secondly, we ought to note that these are young children. You heard what happened in Kumasi at the senior high school of Noost. The kids were so terrified, even the teachers were afraid. These are the things that generate this fear and panic beyond what we're talking about.
Thank you very much, Joyce. We take a break here. We'll be right back. Please don't go anywhere.